Hi, my name is Robert Joy, and I'm a cardiologist at Cardiology Associates of Schenectady. I also work at Ellis Hospital, where the majority of my procedures are done. And what I'd like to do is share with you some ideas about atrial fibrillation. We're going to start with talking about what atrial fibrillation is, how it leads to symptoms, why folks have atrial fibrillation, and then a variety of different treatment options in terms of what we can do to manage it. So, first, let's go into what is A-Fib. And in order to explain this, I have to start by talking a little bit about how the heart's normal electrical system works. And then we'll superimpose what atrial fibrillation is on top of that. So the heart is a pump, and you can picture it. It's roughly divided into two sets of chambers. You've got the top chamber, the atrium, and the bottom chamber is the ventricle. And they work together like a pump. The top chamber contracts first. It's like a priming pump. It helps pump some blood down into the bottom chamber to help it fill. Then the bottom chamber contracts and pumps that blood out through the body to give you your pulse. So it's priming pump, main pump, priming pump, main pump. This timing is all coordinated by the heart's electrical system. You can picture this like there's a spark plug up here in the top chamber of the heart. It fires off and initiates an electrical ripple. One way to think of this is like dropping a pebble in a still pond, and you get this organized ripple moving through the open water. So in this case, the spark plug fires off, and this electrical ripple moves through the walls of the top chamber of the heart, activating each of the individual heart cells, making them all contract as a synchronized unit. Then there's a split-second delay as that electrical signal percolates across this connector, or a phone line, that couples it to the bottom chamber of the heart. That split-second delay is God's design, if you will. It gives a chance for that fluid wave to transmit to the bottom part of the heart. Once the signal gets through that skinny little connector, it zips real quick through the bottom chambers, activating all of the bottom chamber and making it contract as a synchronized unit. So again, you've got this priming pump, main pump, and it's all coordinated by this electrical system with a defined starting point in the top chamber, transit through the top chamber, making it contract, split-second delay across the connector, and then zips through the bottom chamber, making it contract. The next heartbeat is a replay of the same process. Now, atrial fibrillation is a little different. And in our pond model, you can picture this like a storm's whipped up over the water. And the waves are all fast, random, disorganized little ripples or whitecaps in this pond. So if you put your X-ray vision goggles on and looked at the top chamber of the heart, instead of it doing this organized contracting business, it's basically just sitting there quivering. This little part contracts when that wavelet goes by, this part when that wavelet goes by, and it's this continuous disorganized electrical activity. Now, there's three major things that happen when that occurs. The first is you effectively lose your priming pump. So the top chamber of the heart becomes more of a passive conduit than a facilitator helping the bottom chamber fill. The second two have to do with how those electrical signals get through that connector to the bottom chamber of the heart. Because that connector is being bombarded by such rapid little signals, a lot of those signals actually get through to the bottom chamber of the heart, and the bottom chamber is told to go faster than normal. And which one of those signals gets through is a bit of a random thing, so the cadence that the bottom chamber is told to go is irregular. So all three of these things contribute to loss of pumping efficiency of the bottom chamber of the heart. The majority of what people feel, though, is the faster heart rate and the irregular cadence of their heart rate when they go into A-Fib. I liken this somewhat to the idea like putting bad gas in your car and trying to tow a boat uphill. You just lose power. The heart is nowhere near as efficient as it is in normal rhythm. And people have a variety of symptoms from A-Fib. These may be feeling your heart racing, palpitations, the irregular galloping sensation, but it also may be more subtle and more attributed to the loss of pumping efficiency of the heart, such as feeling tired, fatigued, short of breath with exertion, lightheaded, dizzy. Some people even get a sense of chest discomfort or pressure from this.